Almost every week, a patient tells me they said it's just circulation. So I ask one simple question that usually stops the room. Which circulation, artery or veins? Because those are not the same system, and confusing them is how people lose months, sometimes years. If your symptoms were brushed off as just circulation, this is for you. So let me start with the main problem. Arteries and veins get lumped into one vague idea: blood flow. Clinically, they are opposites. Same legs, same word, completely different disease. That confusion delays diagnosis, sends patient to the wrong test, and treats the wrong problem. This is the clear truth. Arteries deliver blood, vein return blood. Different direction, different pressure, different disease, different urgency. Calling them the same thing is like confusing your water supply with your sewer line. They are both pipes, but one fails, the consequences are very different. So, what are the symptoms that separate them? Arterial problems, delivery failure. So, pain with walking because more oxygen needed than delivered. Relief with rest so muscle gets the time to catch up. Coldness, color change, wounds that won't heal. The risk here is tissue loss, even limb loss. How about the venous problem? It's a drainage failure return problem. So swelling, heaviness, aching. Worse with standing, better with elevation. Gravity will work for you. Skin changes, varicose vein. Risk here is chronic damage, ulcer, clots. Let me give you a trick, the three-way clarity test. Here is a simple rule anyone can use. Pain better with rest, think arteries. Symptoms better with elevation, think veins. No changes with either, think non-vascular. Most people were never taught this. So let me tell you about the logic gap. If pain starts when you walk and stop when you rest, you are why you are told to elevate your leg and wear compression. It doesn't make sense. If swelling worsens all day and improves overnight, are you reassured because the pulse is fine? Good intention, wrong system. And remember this: the most dangerous arterial disease often doesn't hurt at first. By the time pain appears, the clock has already been running. And here the part people do not realize. In some arterial condition, compression, which helps vein, can actually worsen symptoms. Let me tell you something about the night pain and gravity. Pain that wakes you up at night and improves when you dingle the leg down is often arterial. Why? Gravity becomes the last helper. Here comes the normal test trap. I hear this consistently. My ultrasound was normal. My pulses are fine. My test did not show anything. A normal test of the wrong system doesn't rule out disease. It just proves we looked in the wrong place. That's why confusing them is very, very dangerous. So, who gets missed most? Risk lives in patterns, not just pain. Smoker, diabetics, prior surgery, long sitting or travel, family history. This is why, so I'm going to give you a practical takeaway. Here, the sentence every patient should feel comfortable saying. Can you clarify whether my symptoms suggest an arterial delivery problem or a venous drainage problem, and why? If the answer is not clear, that's your signal. I'm not saying anyone is careless. I just don't understand how we keep calling two opposite systems the same thing and act surprised when treatment does not work. This has been BenMaamer. Come see us for a free evaluation, clarity instead of another bill. Become a follower, and together we'll change the movement and transform healthcare in America.